Once upon a time, there was a small family consists of a father, Saeed, 35 years old, and he is a policeman. A mother, Salma, 34 years, she's a teacher. And their kids, Salim, 6 years old, Samira, 4 years, and finally Sarah, 8 months. One day, the mother Salma started feeling sleepy with bad mood, depression, diarrhea, and sensitivity to noise. After 24 hours, her condition began to become worse with vision disturbances, seeing colored lines, and a feeling of pins and needles began on one side of her hand and arm. After that, pulsing or throbbing pain in one area of the head appeared with neck pain. The pain was accompanied by nausea, vomiting, sensitivity to light, sensitivity to sound, fatigue, and irritability. The next morning, Salma went to see a doctor, and she was still feeling tired. She explained all the symptoms to the doctor. Directly, the doctor understood how to diagnose the disease, and he said,
I think it's migraine, because migraine headache are usually diagnosed when the symptoms are described previously. Migraine generally begins in childhood to early adulthood, while migraine can first occur in individual in advanced age.
So, what could be the medicine? I suffer too much.
So, for the treatment, using ice and relaxation techniques may be helpful in stopping an attack once it's started. Also, sleeping may be the best medicine. Generally, leading a healthy lifestyle with a good nutrition, an adequate intake of fluids, sufficient sleep, and exercise may be useful.
So, what medicine will you give me?
I'll give you medicine to relieve the symptoms or acute treatments. During attacks consists ergotamine drug. Take 2 mg orally as quickly as possible after the first symptoms of the headache. Additional 1 mg dose every 30 minutes until the headache stopped.
Few months later, when Salma returned early symptoms of migraines, she followed the instructions in taking medication and treatment as described by the doctor. One day after that, she began to notice some symptoms on her baby, Sarah, 8 months old, where she began to suffer from diarrhea and vomiting. So the mother Salma took the baby Sarah to the pharmacy and began to explain the symptoms for the pharmacist. After examination and questioning, the pharmacist said,
The main reason for your baby diarrhea and vomiting is ergotamine. The drug which has taken to treat migraines is exerted into human milk. Vomiting, diarrhea, and convulsions have been reported in nursing infants. So, ergotamine is considered contraindicated during breastfeeding. Please refer to your doctor to change your medicine, and always tell your doctor if you are pregnant or lactating.